Welcome back, everyone. JT Kohut, who's sitting to the distance away from me here, was a PGA golfer living and playing with epilepsy until having 15 to 20 seizures a month put a stop to his PGA aspirations. Now he's on the comeback trail following successful brain surgery. He is now seizure-free. JT is here along with Dr. Cully Cobb, a neurosurgeon for Mercy Medical Group. Doctor and JT, first of all, welcome. This is fascinating when I first became aware of the story. First of all, JT, how are you feeling now?
I'm wonderful.
Are you epilepsy-free?
Yes, I am.
Okay, doctor, how did that happen?
He has had seizures since he was an infant. Developed a fever which triggered damage to the hippocampus, which is a structure in the brain.
Okay.
It's a common area that causes seizures. About a third of all seizures are due to seizures from the temporal lobe, and many of those are due to hippocampal injury.
So you fixed JT. He had epilepsy. He's an athlete. Is that something that anyone with epilepsy can come to Dr. Cobb and you can fix them?
No. You have to have epilepsy arising from areas in the brain that we can safely remove.
Okay, show me, you brought this model. Show me where the areas in JT, in his brain and his head area were affected.
If you look at the temporal lobe is here,
okay,
and the hippocampus is this ridge,
okay, that
runs deep in the temporal lobe, and seizures arose from this area of brain.
Okay, so JT, we've got some interesting pictures here too of you. How were you able to be a PGA aspiring golfer playing with epilepsy? Would it just come up periodically? Would you get warnings that it's coming up?
Yes, I would. I'd get auras. Luckily, I had a lot of friends and family who were able to assist me to get...
That's an amazing photo there, by the way, post-op. I mean, that's just incredible what they had to do to get this.
It's amazing. Absolutely amazing. You know, there was another friend of mine who had another operation, and he also is seizure-free. And that's what got me to see this gentleman, and it's been amazing.
So when you went to Dr. Cobb, was it with the idea that you would get better, or was it with the idea that you might play golf again?
Both.
No kidding.
Yes.
You were that optimistic.
Yes, I was.
Had this been done before on other people, other athletes?
You know what? I don't know. I have not heard of it.
Okay.
I also, at least in my profession, have not heard of anybody else having epilepsy.
So you're playing a round of golf, you're trying to qualify for a tournament. You mentioned the aura. What was that feeling like, and would you have to shut it down immediately knowing what was coming?
Yes, it would kind of be like you would get shivers going down your whole body, and immediately I'd feel a little lightheaded, and I'd have to tell the people in my group that, hey, I'm about to have a seizure, and I'd go aside, and they would be very understanding and just let the whole process go through. It'd be about a minute.
What's the seizure like? What's happening?
What happens is I get in an unconscious state where I don't really, that's time that I lost. I don't know what happened. And the people that I'm with will explain, oh, this is what happened during that seizure. But at that time, I have no idea.
You've seen video and taken video of yourself during the seizure. And
well, I have not taken video.
But there is video of you.
Yes,
and
there is.
And it's been going on, and you have no knowledge of that.
That's time lost. I have no idea what's going on.
So working with Dr. Cobb now, you're going to launch a comeback on the PGA Tour.
Yes.
And you're epilepsy-free.
Free. So
this operation, or what's gone through with Dr. Cobb, has cured you of epilepsy.
Yes.
No chance of it coming back, doctor?
That's not quite true. It's possible to come back, particularly if he doesn't continue to take seizure medication.
Okay.
We usually recommend that people who have had this kind of surgery take seizure medicine for the remainder of their life. The patients are selected by an epilepsy specialist, a neurologist, who in JT's case is Dr. Cruz. He's the epilepsy specialist for Mercy.
So for you, you've had this since you were little, and you don't have it anymore. No. This must be, I mean, if you could even put it into words, what is that like to be able to go forward? You love golf, you love life, and now it's all in front of you.
You know, I was so accustomed to it that not having it and never thinking about it is a distraction that no longer exists. And I'm thankful every day. because everybody in my life, they always have a happy face, and just not having to worry about it is going to help me in my profession because it will not distract me.
Do you feel like you're the test case to give other people hope?
You know, I do in a little bit because I'm more in the public eye, and people now see the effect that this gentleman in the epilepsy center over at Mercy General has done for me.
Wow, that's amazing.
Yes.
So maybe we'll see you
yes.
with the big boys.
Yes.
Because you're way too young for the Masters or the Seniors Tour. The Champions Tour, I'm sorry. Just 35 years old. He's got plenty of time. Doctor, thanks for fixing JT, and JT, good luck.
Thank you very much.
All right, take care. That's a great story. Amy, back to you.
All right, great story.